In this video, I'm going to talk about the pericallosal lipoma. The pericallosal lipoma is a fat-containing lesion in the interhemispheric fissure of variable size. Although a rare lesion, it is still the most common location for an intracranial lipoma. They are divided into two groups: the curvilinear form, which winds around the splenium and corpus callosum, and the tubular-nodular form, which often presents with calcification and is commonly associated with callosal dyskinesis. The pathogenesis of a pericallosal lipoma is considered to be the result of an abnormal differentiation of the meninx primitiva. Histologically, the lipoma consists out of well-differentiated fatty tissue without signs of malignancy. It can encircle adjacent vessel and nerve though. Clinically, the patients are often asymptomatic or may present with seizures. The tubular-nodular type is more frequently symptomatic due to the often associated cerebral abnormalities. When imaged with MRI, you will find a bright lesion on T1, T2, and flare. After fat suppression, the lesion becomes dark. Here you see the bright lesion above the corpus callosum. The straight, bright lesion seen on the other corresponding sequences. After application of contrast agents, there is usually no enhancement. In CT, you will find fat equivalent densities of -50 or -100 pounds per unit. The tubular-nodular form might show calcifications. This is a B1000 image with a corresponding ADC map where you don't see any diffusion restriction. Especially if the fatty tissue does not lay pericallosal but elsewhere intracranially, there are differential diagnoses to think of. A fat-containing falx cerebri, a dermoid cyst, or a teratoma are three fat-containing lesions which may mimic an intracranial lipoma. The first one often contains calcifications and has higher CT densities of +20 to +40 pounds per unit. A dermoid cyst as well as a teratoma generally show a more heterogeneous signal on MRI than a lipoma. Also, a sepicute hemorrhage might be bright on T1 and T2 images, but will still remain its high signal after fat suppression.